Welcome to the Spiritual Psychotherapy Podcast. My name is Jennifer Sneeden, and today we are talking about a very important topic, which is the role of religion and spirituality in treating post-traumatic stress disorder and just treating trauma in general, even for those that don't officially meet the diagnostic criteria for post-traumatic stress disorder. When somebody goes through a traumatic experience, they often lose their connection to a higher power. And once that connection is broken, it sort of amplifies the trauma or the symptoms that they experience. They're unable to make meaning of what happened to them within the context of their spiritual and religious beliefs. How could God let this happen to me? If we live in a loving universe, how is this possible, right? And in severing that connection to whatever they understand a higher power or infinite intelligence to be, now they've lost their meaning making abilities and they're left to sort of struggle with this. The challenge is that most of the modalities we use for treating trauma right now don't incorporate this spiritual or even this religious beliefs. We're helping clients reprocess the traumatic experience to sort of rewire the neural pathways, if you just take EMDR as an example. And these modalities that we use aren't addressing the spiritual nature, despite the fact that somebody with a spiritual or religious foundation, that is a very key part of their meaning making process. So we're not reconnecting them with what they know about the world. We're addressing the meaning making process, but not going deeper in that spiritual and religious connection. It's very common when somebody experiences a traumatic event that they sever that connection with their higher power. And now the strategies that helped them make meaning of things in the past are no longer available to them. I think as therapists, it's very important to us to treat the whole person, incorporating religion or spirituality as part of the meaning making process for those clients. If that was part of their meaning making process prior to this traumatic event, when we can incorporate it back in as part of the recovery from this traumatic event, now we're really treating the whole person. When we can help them reconnect with that, we help alleviate their spiritual distress, right? And this spiritual distress, which is a fancy term for being mad at God or feeling a disruption in your relationship with a higher power. This spiritual distress has been associated with higher levels of PTSD and more severe, longer PTSD. So when somebody experiences trauma and they're now in a state of spiritual distress, their symptoms are going to be more severe and they're likely to last longer. So this spiritual struggle, we have an opportunity to help them make meaning of it, right? Because when this is true beyond PTSD, when all of us go through spiritual struggles, and when we do, either this struggle is going to lead to a disconnect with a higher power, or it's going to lead to a strengthening, some type of spiritual growth. And trauma is an opportunity to help take that spiritual distress, help take that struggle, and turn it into something more positive in the person's life rather than a severing. So we talk to clients about higher power, the meaning, the purpose of life, and the purpose of that as it relates to this trauma. And what's very interesting is when we incorporate religious or spiritual beliefs into trauma therapy, the the treatment, it's just as successful. There's no decline in the successfulness of the treatment, but it leads to improvements in spiritual relationships that last well beyond the course of treatment. So after trauma, we know that people describe their spiritual beliefs. About half of them describe them as helpful, and about half of them describe them as harmful. If we can take the people that describe their spiritual beliefs as helpful, we've got a rich resource that we can incorporate, and we can use that to guide our treatment. For those that recognize, or those that identify their religious or spiritual beliefs as negative after a traumatic experience, we still have a rich opportunity to work with that and reconnect. When we can help people reconnect with that spiritual side of them, now they're more likely to have a better recovery over the long term, and they're more likely to maintain that connection. What's really interesting, when we look at the subscale of, of spiritual distress, that has been correlated with a higher risk of suicide in patients with PTSD. So this is why this matters so much. When somebody is experiencing PTSD and they are also in the midst of this spiritual struggle, this is the divine subscale on PTSD, and they're in the midst of this spiritual struggle, now their risk of suicide goes up. So as clinicians, we want to understand that, and by helping with spiritual distress, we have the ability to neutralize that risk and help people really recover in the long term. Those who view their spirituality or higher power as sources of support and acceptance are more likely to make healthy meanings out of their experience and fully recover than those that don't. Particularly if spiritual distress is part of their traumatic experience, or their traumatic symptoms, their PTSD. So, what the heck does all of this research mean? First of all, it's clear that a lot of people experience spiritual distress after trauma. It's also clear that our traditional treatments to trauma do not address the spiritual distress that so many people encounter. But spiritual distress with trauma leads to a higher incidence of an increased risk of suicide. So, as therapists, we need to understand that when we can put our work with trauma into this spiritual religious framework in a way that serves the clients, now we're not just treating the trauma, but we're treating the whole person and allowing them to reconnect with the meaning making process that had already served them so well in their lives. I know for me, when I work with trauma clients, the first thing I work on is symptom reduction, right? Let's do an EMDR calm, safe place exercise. Let's do some guided imagery. Let's just do something to calm the nervous system, to help them feel a little bit relaxed. And as symptoms subside, now we start to look at the deeper meanings. And in doing that, we can help them experience the spiritual growth so that they are not at a loss for that overall framework in their lives. So, not revolutionizing the way you treat trauma, because we've got some really effective tools in our tool belt for trauma, but can you add to it that spiritual element that invites people to reconnect with the deeper meaning in their lives? So keep doing this work that you're doing, and I will see you on the next episode.